Hi, my name is Julia, and I am a third year medical student rotating with Dr. Ben-Zur. Today I'll be going over second degree AV blocks, also known as MOBITs type 1 and type 2. So let's look at this EKG first. First thing you want to do is figure out the rate, and I'll be doing so by using the entire length of the rhythm strip, which is 10 seconds, and then multiplying it by 6. So here I see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 P waves. So times that by 6 and you'll get 72 beats per minute, more or less. So this patient is neither bradycardic or tachycardic. Next thing you want to do is figure out if there's a P wave for every QRS. And it seems like the rhythm is coming from the P wave because we have a P wave here, a P wave here, QRS, P wave here, P wave here, QRS, P wave here, and a QRS. And it continues so. So the main rhythm is coming from the atrial side, and therefore we can call this sinus rhythm. Another thing I will be looking for in this particular EKG is whether or not the PR intervals are elongating. And if you see this PR interval here, it's about 1, 2, 3, 4, 5 small boxes, as well as here it's about 1, 2, 3, 4, 5 small boxes. So you can't really say that the PR interval is elongating in this half of the EKG. However, if you come over here to lead V4, let's start with this one. We see that it's 1, 2, 3 small boxes long, whereas if you come here, it's about 1, 2, 3, 4, 5, 6 small boxes long. So you can definitely see that the PR interval has increased in this half of the EKG. And therefore, just by seeing that PR elongation, we can classify this as some sort of AV block. And in an elongating from a smaller to a longer one is classically representative of second degree AV block. And now there are two top types of that, MOBITs 1 and MOBITs 2. So in order to figure out whether it's MOBITs 1 or MOBITs 2, we look at how many P waves there are for every ventricular contraction. So we can probably use the beginning side, the left half of the EKG. We see here that there is 1 P wave and no QRS, 1 P wave and a QRS, 1 P wave and no QRS, 1 P wave and a QRS. So essentially for every 2 P waves, there is 1 QRS. Again, for every 2 P waves, there is 1 QRS. This is also known as a 2-to-1 AV block, also known as Winky block. MOBITs type 1. This patient, this asymptomatic 67-year-old male, is experiencing AV block second degree MOBITs type 1, also known as Winky block, in a ratio of 2-to-1. Thanks.